am here at the annual meeting of the North American Menopause Society. I am speaking with,
Dr. James Liu,
and you are?
Professor and Chair, Department of OBGYN at University Hospitals of Cleveland, Case Western Reserve University.
I've known Dr. Liu a long time. He's once more Cookie, and he's been talking, among other things, in this meeting about the impact of progestins and progesterone on the brain. So, first of all, what are progestins?
So progestins are a class of hormones. They are steroid molecules, which are kind of an oily-based structure that bind to certain proteins in cells that then exert specific actions. For progesterone, it is principally needed for reproduction to maintain the uterine lining for the baby.
It's progestation, progesterone.
Correct. And maintain the pregnancy. And it keeps the uterus from contracting as the baby increases in size inside the uterus. And one can interrupt this process by giving an anti-progesterone in early pregnancy. And that's the principle of the medical abortion pill.
So we have progestins, which are synthetic progesterones, and progesterones, which are the so-called bioidentical ones.
Right. So natural progesterone is made by the ovary after a woman releases the egg every month. And it is then acts on the lining of the uterus to mature the lining, to allow the normal biochemical exchange for the embryo to implant into the uterus and establish a blood supply and maintain the pregnancy.
So we hear a lot of talk in menopause about estrogen. I mean, there's a lot of talk about estrogen, but progesterone's doing its thing too. What is progesterone doing in women?
Progesterone in the menopause is naturally low, just like estrogen, because the hormone comes from the ovary, and so when a woman is in the menopause, the egg supply has dwindled to very, very low levels, and so no estrogen or progesterone is made by the ovary. However, there is a small amount made by another gland in the body called the adrenal gland, and that is kind of a steady state. I would call it a leakage of byproduct as opposed to a biological function. For women that have a uterus and are put on estrogen hormones, then progesterone becomes necessary to prevent the lining from being too thick to a point where it could become a precancerous or cancerous lesion.
So it's protecting the uterine lining from estrogen if you have a uterus. So what happens in the head, in the brain? Is progesterone serving a purpose there?
Well, it's a what I call an off-target effect. That is, there are progesterone receptors in the brain, just like there are progesterone receptors in the uterine lining. And so a woman may feel somewhat similar to what she felt during the after ovulation phase or the luteal phase of her menstrual cycle when she was having menstrual cycles. So she may be a little bit more moody. She may have achiness and things like that right prior to bleeding. So generally women don't feel as well when they're on a combination of an estrogen progesterone in this kind of time frame. Progesterone, when we give it clinically, is not normally released into the body through the GI tract. Normally your ovary secretes it into the bloodstream directly. So when you take progesterone orally, it's converted by the liver before it even sees the circulation. And that conversion causes some of the progesterone to change to a different kind of metabolite as a breakdown product. And that breakdown product is called 20-alpha dihydroprogesterone,
Mm-hmm.
and it has an effect on the brain to make a woman drowsy or sleepy. And
So the progesterone has a kind of a sedative effect on the brain.
it can, and it can vary from one woman to the next. So, women on certain doses of micronized progesterone orally may have no drowsiness, and others will be very, very sensitive to modest doses of micronized progesterone.
Now, when you're having menstrual cycles, some women have PMS, and some of that has to do with relationship of progesterone to the brain. Is there a mood element in addition to the drowsiness with progesterone?
There can be, and it depends upon two elements. One is the fact that the brain is already exposed to an estrogen.
Mm-hmm.
So, in the absence of an estrogen priming, the mood changes may be diminished even if you add progesterone. So, if a woman wasn't on estrogen for some reason, she took progesterone naturally for some compounding reason, but not for a uterine issue, then it may change the fact that she wouldn't experience the same mood disturbances if she was exposed to estrogen prior to adding the progesterone.
So in some women, it may smooth their mood out.
It might, but there's not enough evidence that this is a consistent feature.
Mm-hmm. So I have heard from some papers I've read that there may be some anti-inflammatory component to progesterone, and I'm wondering if you're aware of that or if you have any thoughts about it.
There is some fairly good animal evidence and cellular evidence that progesterone is anti-inflammatory. It has been used in clinical trials to reduce the inflammatory response to neurological damage. One example would be individuals that have had a spinal cord injury
Mm-hmm.
from an accident, like diving into a shallow pool. And those individuals are given high doses of progesterone, which gets into the circulation quite readily,
Mm-hmm.
and it appears to reduce the inflammation that can cause additional scarring at the spinal cord trauma site.
That's
Uh,
interesting.
And also there is, again, small studies that look at its use in stroke,
Mm-hmm.
giving high doses of progesterone to decrease the inflammatory response associated with the lack of oxygen to certain parts of the brain, and it seems to reduce the fibrosis or damage as part of that repair process that the body normally goes through. So we believe that that is due to the anti-inflammatory features. There is now a growing concept of a sort of a generic protective response by the body called the inflammasome, which is a kind of a cohort of chemical reactions the body has to injury, infection, trauma. All of those kind of have the same final steps, and progesterone seems to modify the inflammasome process.
I have one final question for you, and that is most women who have a uterus have to take estrogen and progesterone, or a progestin, some kind of progesterone type medicine. But women who are don't have a uterus only need estrogen. Given the upside of progesterone, at least in these different things you've talked about, can you envision a time when progesterone would be appropriate for women just because of these other benefits as a theoretical concept?
Probably not in this situation right now. I think the evidence is concerning that progesterone can stimulate breast tissue, and in the menopause we don't normally see progesterone in any great amounts, and so I think that there's some caution one might express in administering progesterone to women who don't need progesterone for uterine protection. So I think the caution would be not to add an additional hormone that doesn't exist in a natural setting.
So jury definitely out on that one.
Correct.
Thank you so much.